Go ahead, ma'am.
Hello all, I am Dr. Hema Vaithianathan, Fertility Consultant from Oasis Fertility, Chennai. So in this session, let's understand everything about secondary infertility. So secondary infertility is a type of infertility when a couple who has a child or who has already achieved a pregnancy, and if they are trying for the second pregnancy, if they find it difficult to fall pregnant, then it is a type of infertility known as a secondary infertility. So infertility as such, it means when a couple cannot conceive after if they are trying to conceive for at least 12 months. And the types are actually primary infertility and secondary infertility. So secondary infertility is, as I mentioned, is a type of infertility when a couple cannot conceive or carry a pregnancy to term after giving birth or having achieved a pregnancy in the past. So the most of the time the causes, the reasons for secondary infertility is the same as such in for primary infertility, but there are some unique causes that can cause secondary infertility, and the way we evaluate the couple for a secondary infertility is slightly different than how we evaluate a couple if they have had a primary infertility. So for this, let's understand the causes of for secondary infertility, and then we'll see the investigations and type of treatment options. So the causes for primary infertility and the secondary infertility, majority are the same, but some unique causes for secondary infertility are fallopian tubal blocks. So fallopian tubal blocks, but can be other causes also, like anovulation. Anovulation in the sense if the woman is not able to ovulate regularly. In that case, most of the common underlying reason for anovulation will be polycystic ovary syndrome or PCOS. Sometimes it is because secondary infertility, sometimes it is because the women's ovarian reserve or the women's egg count is low than for her age, like that in a condition known as a premature or primary ovarian insufficiency. Or sometimes the progress of the problem, the gynecological problem, like endometriosis, if it gets severe, like it progresses to stage 3 or stage 4, then it may pose difficulty in conceiving the next time. So secondary infertility, sometimes it's because of the progress of endometriosis resulting in problems in endometriosis, chocolate cysts, or progressing to stage 3, stage 4 endometriosis, where it can cause problems in conceiving the second time also. And also another important reason for secondary infertility sometimes is the fallopian tube block that's happening because of infections that happened after the achieving the first pregnancy. So pelvic inflammatory disease sometimes can be a very silent infection. So usually the women may not have any symptoms for this pelvic inflammatory. Sometimes it can be asymptomatic. That is, the patient will not even have any symptoms, but on testing, the fallopian tubes may be having a block because of the sequelae of that pelvic infection. So the most common type of bacterial infection that can cause this kind of a silent block in the fallopian tube is the infection caused by a type of bacterial organism as a chlamydia trachomatis, which is a very common type of infection that can cause in these type of asymptomatic pelvic infection, and subsequently as a sequelae of recovering from that infection, women may develop a pelvic infection and a block in the fallopian tubes. So this kind of fallopian tubal blocks can cause infertility, especially if the fallopian tube blocks happens in the fallopian. And also because some of the uterine problems, if it progresses over time. So women may conceive in the first time. So subsequently, if she during the time interval that she has taken to decide and plan for her subsequent pregnancy, some of the problems in the uterus also can progress, and that may result in secondary infertility if the woman is trying to conceive in the future. So some of the uterine problems that can progress and cause secondary infertility is the presence of uterine fibroids. So we will deal with, or we will elaborate, or we'll understand all this in the further slides. So one of the major problem or the common problem that women is facing nowadays is polycystic ovary syndrome. So PCOS is becoming a very common endocrine problem that women are dealing with. PCOS causes infertility primarily because PCOS affects the woman's ability to ovulate in a regular basis. So if there is no ovulation in a particular cycle, if a couple is trying to conceive in that cycle, if there is no ovulation, there is the chance of achieving pregnancy is practically nil. So hence PCOS problem, if it is associated with anovulation or if it is associated with infertility, then it definitely needs proper evaluation and proper management. So almost like 10 to even 20% of the females, if they come for infertility evaluation, we are seeing the presence of polycystic ovaries in their ovaries, and it can also polycystic ovary syndrome as such. It doesn't mean there is presence of cyst in the ovaries. It is a misnomer. So usually there will be some fluid-filled sacs or follicles can be higher in the ovaries, and also the ovary volume of the ovary will be high, and there won't be any irregular ovulation. So other major problem could be because the ovary is losing its function. If the woman is trying for the second pregnancy and if she is taking a longer break, or if the age is above 35 plus, naturally the ovary will lose its function. And also after 40 years there is a significant decline in the fertility. So if the secondary infertility can be a problem because the woman has taken a longer break to plan the second pregnancy, so hence we have to assess the ovarian reserve for the women to understand if she is having this borderline ovarian reserve or a lower ovarian reserve. So some of the tests that can help us to identify this is the blood test known as testing the serum anti-Mullerian hormone levels, and then we can also assess this by an ultrasound, which should be done in the day 1 or day 5 of her period cycle, where we can count the number of small follicles in her ovaries, which is known as an antral follicle count. So two major common tests that we can do to identify this ovarian reserve is serum anti-Mullerian hormone levels or the AMH levels, and then we can do it by a scan by counting the antral follicles known as the antral follicle count. So evaluating for ovarian reserve and identifying if the egg count is normal for the age is an important test. It should be done for a couple both with primary infertility problem as well as secondary infertility problems. So some of the causes for this premature ovarian insufficiency or having a lower AMH or lower egg count is usually there is not an identifiable cause. Sometimes it's because of problems that are not identifiable by routine testing. Like some are because of the genetic problems, some is because of the other associated conditions like endometriosis or problems because of infection in the ovaries or because of any surgical treatment in the ovaries also can reduce your AMH, and also that can reduce your egg count. So this is one of the testing that is necessarily has to be done if the couple comes with secondary infertility. Another major problem or the common problem that we see if a woman comes with secondary infertility is also endometriosis. So endometriosis is a gynecological condition. It is a progressive disease. So because the woman may be in a very early endometriotic stage, she had attempted her first pregnancy, or so subsequently the disease will progress, endometriosis, if it is not controlled by medical management or a proper follow-up and treatment if it is not taken, and the woman is trying to achieve a second pregnancy. So by then endometriosis can progress to stage 3, stage 4. In that time it can cause difficulty when she is trying for the second time. So what I'm meaning is endometriosis can be a problem for if a couple is having secondary infertility, and hence it needs evaluation to identify the stage of endometriosis. So endometriosis practically it is an inflammatory disease in the pelvis. So it can affect the fallopian tubes. It can affect mainly the ovary also. Thereby it can form a type of cyst known as a chocolate cyst. It can affect the way the women ovulating, or it can affect the egg count in the ovaries. It can affect the quality of the oocyte. So there are various different mechanisms by which endometriosis can affect women's fertility, and thereby it can lead on to secondary infertility. And also in endometriosis, there is formation of a scar tissue, which can also cause mechanical distortion in the pelvic area, and also it can affect the reproductive anatomy, the way the uterus is positioned or the way the fallopian tube and the ovary is attached. It can affect the distortion, or it can cause a distortion of the anatomy in the pelvis, thereby it can lead to infertility also. And also endometriosis affects the uterine health also. can affect. Sometimes that can be coexistent problem known as adenomyosis, which some of the women has along with endometriosis. That way it can affect fertility. Also, endometriosis can affect the uterine microenvironment. That way it can also affect implantation of the embryo. So there are various reasons how, or various mechanisms how endometriosis can affect women's fertility. And also, I want to stress the fact here that endometriosis is also a problem for women and secondary infertility. As mentioned, having a pelvic inflammatory disease is also another condition that can affect the health of the fallopian tubes. Thereby, it can prevent the transport of the eggs, that can prevent the transport of the sperms in the fallopian tubes and can cause fertility issues. Also, genital infections can happen in the can spread to the uterine environment and can affect the uterine microbiome also and cause a problem known as endometritis. Thereby, it can affect or prevent the embryos from having improper implantation, thereby causing fertility issues. Hence, any type of genital infections can ascend to the pelvis and cause pelvic inflammation, thereby can causing problems in the fallopian tubes, problems in the pelvic area, causing adhesions, thereby it can affect fertility. So, about 1 in 8 female with a history of pelvic inflammatory disease they had previously, it can subsequently affect in the long term their fertility. And hence, we always do this standard testing known as testing to find out the tubal patency, which is testing to rule out fallopian tubal blocks. So, fallopian tubal block is one of the common cause for secondary infertility. Any problems like, as I mentioned, infections due by chlamydia infections or any pelvic surgeries can affect the fallopian tubal patency and cause damage to the fallopian tubes and can affect the fallopian tubes. And hence, doing a test known as fallopian tubal patency testing is one of the important testing for women coming with secondary infertility, and hence to rule out this fallopian tubal block. Another causes, as I mentioned, is the uterine causes. Any fibroids. Fibroids, as you all know, it's a small muscular growth in the uterus. Fibroids can also slowly progress over time, and if the fibroid is in a very it depends usually on its size and it depends on the location of the fibroid, how it affects the fertility. For example, if the fibroid is in the inside of the uterus, inside the uterine cavity, it can affect the way the sperm moves to the fallopian tube. It can affect the embryo implants in the uterus. Thereby, it can cause a mechanical as well as inflammatory problem inside the uterus. And fibroid can affect fertility based on its location and based on its size. So fibroids can be assessed. The presence of fibroids can be assessed by a regular transvaginal ultrasound, and hence doing a transvaginal ultrasound to rule out problems of pathology in the uterus is the important investigation when a couple presents with secondary infertility. So what are we looking for is the presence of fibroids as well as the presence of another gynecological condition known as adenomyosis. So adenomyosis is a condition where the uterus muscle layer gets thickened, and hence it can also affect the inner lining of the uterus, causes inflammation, and thereby it affects fertility. So fibroids, adenomyosis, adhesions of the inner inside of the cavity of the uterus, polyps, or sometimes the uterus itself can have congenital anomalies, presence of a septum inside the uterus known as septate uterus, presence of double uterus known as biconvate uterus also are some of the common uterine anomalies that can cause fertility issues. And hence, as a baseline, having a baseline transvaginal ultrasound is an important investigation to rule out all these uterine problems that can cause secondary fertility. So these are some of the major causes in a female who is having a female secondary infertility. So what are the causes that a man can have if the couple is having secondary infertility as an issue? So we are offering semen analysis as a baseline testing because there are a lot of other factors that can affect, of course, abnormal semen parameters that can result in a secondary infertility in a couple. So abnormal semen parameters is an important cause for secondary infertility. So semen analysis is a baseline test that is an important test to rule out if the man is having low sperm count or if the sperm is having poor motility or if there are problems with the shape of the sperms that preventing the pregnancy. So these are the basic testing analysis. Testing for a couple with secondary infertility to rule out all the problems in the sperm like count, motility and the shape issues. Also, one of the important cause for secondary infertility in men once they've achieved a pregnancy successfully in the past also, the onset of a condition known as varicocele can affect the sperm parameters and it can cause secondary infertility in men. Hence, doing testing for the presence of varicocele, both clinical examination as well as scrotal ultrasound can help identify this problem known as varicocele, which can cause secondary infertility. Also, over time, if the men is having advanced paternal age or because of body weight issues, or use of certain medications for any chronic illnesses can affect the sperm parameters, thereby it can result in secondary infertility. So these are some of the major reasons in men they come with secondary infertility. So if a couple has secondary infertility, it actually the management is based on identifying the underlying causes, what is causing their secondary infertility. So once the cause is identified, the treatment can vary whether the condition is reversible or it can be treated. So some of the treatable conditions has to be corrected, like the presence of varicocele and other issues in men can be corrected. So if this could improve their fertility, then falling pregnant second time should not be a problem. But it is always very important to have an assessment when the couple is having this secondary infertility as an issue. So having a baseline assessment by a fertility specialist is the first step that you can take. And once a problem is identified or any of the underlying factors is known, then it is easy to correct the problem. Then also it is easy to identify and give you an individualized treatment, whether it is in a natural conception to try spontaneously or to go for an IUI, or sometimes IVF also can be needed for secondary infertility. It really depends on the underlying problem. So taking evaluation with a fertility specialist is always the first step if the couple is having secondary infertility. So that is all about secondary infertility that you have to know. So please let me know if you have any other further queries for us to answer. Thank you so much for your time.